This is Listen St. Louis with Carol Daniel. When I think about the critical issues facing Black and brown residents in the St. Louis area, I often ask the questions: how did we get here? What's holding us back? And how do we progress? At 9 PBS, we want to deepen our understanding and change the narrative. Join me as I look for answers and discover solutions on today's podcast. These men have something in common. TV host Al Roker, retired Major League Baseball All-Star Ken Griffey Sr., and the late former chairman of the Joint Chiefs of Staff, Colin Powell. They were each diagnosed with prostate cancer. The disease would take the lives of Dexter King, the son of Martin Luther King Jr. and O.J. Simpson. Black men are nearly twice as likely to be diagnosed and 2.1 times more likely to die from prostate cancer than white men, and more likely to be diagnosed with advanced stages of the disease. Today, we meet a man on a mission. After Mellve Shahid was diagnosed with prostate cancer, he launched the Empowerment Network to raise awareness. Today on Listen St. Louis with Carol Daniel, find out how he survived and what message he wants other Black men to hear. That's next on Listen St. Louis with Carol Daniel on 9 PBS.
Listen St. Louis with Carol Daniel is supported in part by Midwest Bank Center, the Betsy and Thomas Patterson Foundation, and Orvin and Latrice Kimbrough.
Welcome to another episode of Listen St. Louis with Carol Daniel. I'm your host, Carol Daniel, and I just want to start by thanking you. Thank you for tuning in. Thank you for liking the podcast or subscribing to the podcast, and definitely thank you for sharing the podcast with your family and your friends and your colleagues. So it's very simple. There's a like button right there. You just click like, and there you are. Subscribe. There you are. We appreciate that so much. And if you have ideas about other topics or guests that we should have on the podcast, make sure you comment below, and comment anyway. Today's conversation is one that I hope women listening, you share with your fathers, your brothers, your husbands, your cousins, the men in your life. As you heard me say, Black men are more likely to be diagnosed with prostate cancer, more likely to be diagnosed with an advanced case of prostate cancer. Why is that the case? My next guest, I love calling you a man on a mission, Mellve Shahid. Welcome to Listen St. Louis.
Thank you so much, Carol. Thank you. It's an honor to be here with a legend. It is. It's an honor.
I appreciate you so much. And we've known each other for quite a few years. And I want to talk about the Empowerment Network and all the good you've done. I said you're cancer-free. How long have you been cancer-free?
Well, I am a 17-year prostate cancer survivor, an advocate, and a servant to men diagnosed with this disease and families.
So let's take us all to that time when you're told by the doctor that you have prostate cancer.
Well, it started with a simple phone call. Received a phone call from my urologist indicating that I had a very, very aggressive form of prostate cancer. It was stage 2. And at that time, he had given me 2 years to live. 2 years to live. I've
heard your story. I did not hear that part.
Yeah. He had given me 2 years because of the cancer was so aggressive, So, I made a covenant with Almighty God. I had promised God that if he would heal my body, restore my health, and give me a second chance, that I would spend the rest of my life, and I would dedicate my life to this mission, to this cause, helping men and families with a disease that's claiming lives in our community at an alarming rate simply because men will not go to the doctor.
Were you one of those men?
No, I was actually going to the doctor.
Okay.
I had very good insurance. I worked for Chrysler Corporation for 34 years. I had good insurance, but it was the numbers. My doctor was not watching the elevation of my numbers. And that's one of the things that we often tell men now, that the human body is all about numbers.
Right.
Life is about numbers.
For sure.
Not only the numbers in our bank account, but also the numbers in our health account.
Right.
You know,
our age, our blood pressure.
our blood pressure,
yes.
our heart rate,
My doctor said your cholesterol numbers, hello.
Right,
all those
cholesterol.
numbers,
Everything
yes.
is about numbers. So after we get to a certain age, or maybe the age of 40, just watch our health numbers.
Right. So you had been going to the doctor.
Going to the doctor.
You had been getting the PSA test.
Right. But I didn't know, at that time, I didn't know what that PSA test meant.
Mm-hmm.
You know, and so every year my numbers were going up, but the doctor was saying to me, everything is cool.
Really?
And I tell men that now, Carol. Cool is not a number. Cool, all right is not a number.
Right.
What are your numbers?
And you need to know your
and
numbers.
You need to know what those numbers mean.
Prostate specific antigen is
Yes.
what PSA stands
Yes.
for. And men should get their first PSA test generally at 50, but black men earlier.
Right. Because we have a higher incident of this disease. You know, and so we encouraging men, especially if they have a family history.
Mm-hmm.
You know, they need to get into the doctor's office and take that simple blood test.
Simple blood test.
It's just a simple blood test. You know, a lot of times we get that confused with the digital rectal exam. They don't have to bend over a table. There's no rubber gloves involved in this. It's just a simple blood test. And it's that simple blood test that can save their lives.
And is this still an uncomfortable conversation that men are not having because it's uncomfortable?
Well, that's where the Empowerment Network came in. We made it a conversation because everything in life is about a conversation. So we made it a conversation to engage men in this conversation about a disease that, like I said, claims lives in our community. And at one time, it was a whisper.
Right.
It was a whisper. Men just didn't talk about
At all.
prostate cancer. Many men have died over the years, you know, and they died of a heart attack simply because they didn't want anybody to know it because of the stigma around the disease and the myths around the disease, you know. So the Empowerment Network turned it from a whisper into a conversation.
And we want to be clear, men have a prostate, women do not. The prostate is a part of the sexual organs of men. Produces not all, but a significant amount of semen.
Right.
And so that is why.
Right.
That is why.
And that's the only function that it plays.
Mm-hmm.
That's the only function that it plays, you know. But men often feel that it's a part of their manhood.
Right.
It's a part of their man. And when they lose that, they lose their manhood. But I'm here today to tell the men in St. Louis that that their prostate gland don't identify them.
Mm-hmm. Not at all.
Not at all. You know. Our families are so much or more of a value to us. You know. Our families, you know, and our life and
your presence in our lives is meaningful.
Yes,
we need you.
Right.
We don't need you because you have a prostate.
Right. What the prostate have to get you here?
Well.
That's it. That's the only function that it plays.
Right.
You know. So we're encouraging men to get tested for prostate cancer. Because it could save their life.
And black men get tested earlier. And is it 40 even? 10 years earlier black men should
40,
start getting?
Well, we encourage men at the age of 40 to take this simple blood test.
Yes.
Especially if there's a family history.
And if your doctor says to you, your numbers are cool, get your actual numbers.
Right. You need your numbers.
And the higher they are,
right.
that is a cause for concern.
And they need to monitor their numbers. And I often tell men, monitor your prostate numbers like you do what's in your bank account. Mm-hmm. You know, if it's a dollar missing out of our bank account, Carol,
yeah.
We know it. Why? Because we're watching the numbers. So we need to watch our health numbers.
What are the symptoms if one is not going? Are there symptoms?
There are.
And you and I are not doctors, so
we're not doctors, but there are some symptoms. I know that painful urination, getting up at night, frequently
to go to the
lower
bathroom.
back pain. Those are symptoms. But, Carol, in the earlier stage of prostate cancer, there are no symptoms. I had no symptoms at all. I felt like $1 million and this disease was running rampant in my body.
My goodness.
So it can come in as a silent killer, just like blood pressure.
Absolutely.
When the symptoms hit, oftentimes it's in another stage.
And so we don't really know why Black men are diagnosed earlier, die more. We have an understanding of why one would die more frequently than other men because you're not diagnosed earlier, because it is treatable.
Right. Well, there's risk factors. I mean, age, diet, chemical exposure, and race are all risk factors. But to actually say that they know what causes this disease,
Do not know.
they do not know.
But we can engage in prevention.
Right.
And that starts with diet.
Right. Prevention, education, awareness,
Screening.
all help to save lives.
Talk to me about when you, at the point that you survive and God answered your prayer. I believe you made that covenant with God on the operating room table.
Right. Well, it was when I made the covenant with the creator of the heavens and the earth, I decided to step out and to take this disease to another level, because the disease needed a face. It needed a personality.
Right.
It was engrossed in secrecy.
Yes, it was.
You didn't even hear me mention the word prostate. So I am an advocate, for the disease and for the cause, and I wanted to make a difference in the lives of men in the community. I never knew that it would grow to the extent that it has grown now.
Because I seem to recall that it was immediately embraced in a way.
Right.
That it seemed as if men were waiting for someone to have this conversation because they didn't know where to turn.
Well, it's amazing how God always prepares you before he uses you. And I'm just that vessel that he used, to get the message out about early detection is the best protection. If we can get up on top of this disease early, get screened, we can save lives.
What were you hearing from men in the early days of the Empowerment Network?
Well, they really didn't want to talk about it, and that's the reason why we made it a conversation. We started talking about it. We started, you can't rectify anything that you're not talking about.
That you don't face.
That you don't face, you have to, the great Willie Jolly said you have to face it, trace it, erase it, and replace it.
Love Willie Jolly.
Love Willie.
Yeah.
He's a good friend of mine.
Is he?
Yes, he is.
Motivational speaker Willie Jolly.
Oh, yeah,
yes.
yeah. He's a great guy, and we have to face it, trace it, erase it, and replace it if we want to live.
And did it grow because you started talking first? Survivors began talking.
Right. Well, that's another aspect of this disease. One of the aspects of this disease that I seen, there was no support. There was no support in our community for men diagnosed with this disease. Psychologically and emotionally, when men received the cancer diagnosis, they were broken. They were wounded. They lived in shame, disgrace, and silence. So the Empowerment Network started the first support group in the city of St. Louis for men diagnosed with this disease. We started in 2008 with 7 men. And in 2009, we had over 100 men in the room, and we received the American Cancer Society Harold P. Freeman Award because we brought to the city of St. Louis support needed for men battling this disease. We just grew from there.
And that was never there before.
It wasn't there.
Why is there shame?
Because men see this as an indictment on their manhood, only because they don't understand what real manhood is. And I often tell men that prostate cancer don't define you as a man. In my upcoming book, Carol, that I've
now, breaking news. Breaking news.
That's the title to my upcoming book. You're still a man.
Oh.
You are still a man. Because prostate cancer do not define you, and it don't define your manhood.
Okay, let me get super delicate
here.
Okay. After a man has had prostate cancer has had, is the prostate generally removed?
No, there's different, not
Different
always.
levels.
There's different
Okay.
levels. Like I said, we're not doctors. I mean, but there, it
That
based
is
on
not the foregone conclusion.
no. I mean,
And I think the delicate, where I'm going to get delicate is there shame because there is the notion, because you mentioned myths, that prostate cancer means complete erectile dysfunction.
right. That's the myth.
Yeah.
There's those myths there. But the world of science,
Yeah.
world of medicine. Thank God. First, I got to shout out to all the great doctors,
Right.
the great scientists, the great researchers coming from great institutions. I got to shout out to the Siteman Cancer Center.
Right. You have the best.
Magnificent. I mean, we got one of
World
the
class.
world class
Yeah.
science research centers in the world right here in St. Louis. Men do not have to live in shame and disgrace. I would say sexually, there's life after prostate cancer.
And that is worth saying.
Yes.
Because that alone, for whatever reason, would stop a man from even going.
Men have gone to their grave, Carol, because they didn't understand that there is life after this disease, psychologically, emotionally, and sexually.
The enlarged prostate, that doesn't mean that you have prostate cancer
No,
either.
no.
And men get fearful.
No. From my understanding, not being a doctor, I'm just a cancer survivor, that many men will probably have an enlarged prostate before they leave this earth. I mean,
That's
the
just
prostate
age.
it's
That's just
a
age.
gland that grows. It grows in a man, and it cuts off the urine flow, and as a man gets older, his prostate gland gradually grows.
Which means you're peeing more often.
Yes.
So that's one of those
It takes a little
signs.
bit longer.
Yes.
It's
Yeah.
a sign of the gift of old age.
Yeah. You're still alive.
You're
people.
still alive.
You're still alive.
You just have to stand there a little bit longer.
And I have always been so moved by a black man doing for other black men, because there is that myth that callous, that black men don't care. There's all kinds of myths about who black men really are. And to watch you move and do this for now decades has always been so moving to me as the wife of a black man, the daughter of a black man. I gave birth to 2 black men. They're now young adults. I love black men. And so thank you, number one. Let me say to you, thank you publicly for doing what you have done.
But Carol, I'm honored. I'm humble. I'm thankful. I'm grateful that God has blessed me with this gift that I now share with the city of St. Louis. And Carol, we're sharing this gift with the nation now. We have a cancer survivor that's all the way in Ireland that zooms into our support group. A great friend of mine. We have become great friends, and he needed support. He Googled prostate cancer support in the United States, and he said the Empowerment Network's name came up everywhere. He contacted our office. I thought it was a prank. We set up a Zoom, and we were able to help him all the way in Ireland. We sent him a beautiful brass bell. We sent him a robe. He is a part of the Empowerment Network support group, and I'm honored to have him and the 300 or more survivors that make up our organization.
What change have you seen simply because of awareness?
I've seen, because of awareness, I see more men are stepping up. I want to give a big shout out to my friends, to Bishop Michael Jones over at the Friendly Temple Church. We were just over there Sunday, pre-Father's Day testing event. We tested over 100 men for prostate cancer. So the prostate cancer now in St. Louis, the churches have gotten involved in it, and which has made a difference because, let's face it, the black church has been a major part of change from the civil rights movement and a lot of the movements. Now they're getting involved in the health movement,
Right.
and it's helping to save lives.
Yes, it is.
It's helping us save lives, and I often tell my great pastor friends, a healthy congregation is a productive congregation. When you have a healthy congregation of men, they're there to protect the church. They're there to keep the lawn cut. They're also there to pay tithes.
Yeah, well, there's that. How about that bottom line? Prior to your diagnosis, were you even aware of prostate cancer?
I heard very little bit about it. Very little bit about prostate cancer. Over my 53 years before I was diagnosed of this disease. That's the reason why the awareness, the information, and the education is so important, Carol. It's so important. We have to now create the awareness before the age of testing.
Right.
With our young men, they need to know that one day they will have to step up and take that simple blood test. So that's the reason why what's that one store said, an educated consumer becomes your best customer.
Right.
Through information and through education. And when you do that, you don't have to sell them anymore. They will automatically every year say, hey, it's time for me to go to the doctor, get a physical exam. And doc, where I'm there, give me a PSA test so I can know my numbers.
And it's certainly for women who breast cancer is a much larger discussion, much deeper awareness, because women give birth. We are focused on caring for our bodies in a very different way, clearly, than men are. And do you see that changing? Are more men more willing to take better care of themselves?
Yes, I do. I see that changing. I think men are, but once again, it's the information and the education that's making men now better understand their value in life and understand, that health is wealth.
Right.
That health is proactive. Cancer is reactive. Health is encouraging. Cancer is totally discouraging. So going to the doctor is important. And let me do a big shout out to our sisters, to the black women out here, the beautiful caregivers, especially those who take care of our prostate cancer survivors, or the wives out here. I want to thank them publicly, because without you, there would be no us. Many of our survivors in our organization are here because their wives gave them a gentle push. Sometimes y'all have to push us into the doctor's office.
Sure.
Without that push,
right,
men do not go to the doctor. So I want to just do a big shout out to them and thank them for being there for us a lot of times when we wasn't there for you.
You know what? Now I can tell you, not when we met, but I know how old we were. How old Patrick and I were, because after I got involved with the Empowerment Network, I'm 62. We would have been, I think, over the age of 40, just over 40 years of age.
Okay.
And I started learning more about prostate cancer. I'd not heard anything. I didn't know that black men were more likely to die, to be diagnosed later, to have more advanced cases. I didn't know any of that until I got involved with you and the Empowerment Network. And I called my husband's doctor.
Okay. You made the phone call.
I made the phone call.
Okay.
I mean, we actually had the same primary care. So
Right.
I called him and I asked him, when should Patrick get a PSA test? And he said, I think it's 50. And I said, wrong, wrong. He's a black man. It's 40.
Okay.
So he then got that.
That's good. That's
and,
beautiful.
And the doctor, I didn't realize that. And I didn't know
But the doctors have to be educated.
They have to be educated.
They have to be educated too. Remember, a lot of times, our primary care doctors, they're like the quarterbacks. They're the quarterbacks on the team. They call the plays. They say you need to go to a specialist for this, or you need to go to a specialist for that. So sometimes, oftentimes, that's just not what
They're not calling the right play.
They're not calling the right play. So it's so important that you educate yourself so that you will know too that going to the doctor and knowing when to go to the doctor is important.
What is next for the Empowerment Network? And because I know you're having walks every year to raise awareness, correct?
Right. We have the Zero Prostate Cancer Walk that's coming up. September is National Prostate Cancer Awareness Month. So during the month of September, we kick it off. We'll probably be we're working on a press conference now. We'll be doing the Zero Prostate Cancer Walk, educational forums throughout the month of September, and our annual gala. We'll be doing our gala, which is our major fundraiser to keep money coming into the organization, because we often say, you know, the old saying is money on the wood make the game go good. Without money, there's no game. I mean, without money, you can't save lives. You know, you need money to save lives. So, you know, can I give out the phone number to our cancer information there?
You can.
All right.
You already said it.
All right, the Empowerment Network, area code 314-385-0998, or they can go on our website, tenstl.org, tenstl.org. We have the first cancer information and educational center in the St. Louis community. It's in the community. It's not in the hospital or institution. We brought cancer information into the community. We have information on breast cancer, colon cancer, lung cancer, but primarily we have information on prostate cancer. So the community is welcome to stop by our cancer center. And basically everything that we do is free. Let me say that again. Everything that the Empowerment Network do is free. You know, we don't charge for our services. It's free to the community, and we love helping the community.
I can't help but imagine that probably one of the most moving things you do is when you do bring them in together to the survivors group together to
and
talk.
Let's talk about that, girl. Everybody don't survive.
Right.
You know, I just lost a guy. Everybody don't just survive this disease. It would be beautiful to say that you're going to survive. No. Early detection is the best protection. The Great American Cancer Society, who I want to salute to, because the American Cancer Society does great work. The American Cancer Society says that there's a 95% or close to 100% survival rate
with early detection.
Mm-hmm. No man should die from this disease. No man should die from prostate cancer. You know, you can live without a prostate gland. And Carol, this is an old problem. You know, and I often tell people that prostate cancer is nothing new. It's an old problem, health problem among men that needed a new approach, and the Empowerment Network, I believe, helped to bring that approach and helped to bring that change to the community of St. Louis.
Well, we appreciate you so much, and two messages to young men and to men at that age of 40. Get the PSA screening test, and to young men, you can prevent as best you can. Know whether you have a relative who has prostate cancer.
Family history.
Family history is important.
So important. It's probably the second or third question asked when you go in your doctor's office. Number one question, do you have an insurance card? You know, that's the number one question. What medications are you on? And then you'll probably get a clipboard, family history.
Family history.
So family history is so important.
Which that then means talking to your dad, talking to your grandfather, talking to your uncle, and finding out. Right.
And that's something that we should talk about at the kitchen table. And those are conversations that we need to have, because it's those conversations that really can help to save the lives of a family member.
What I walk away with, in addition to everything else about awareness and screening, is that one thing you said in the beginning, and that is that you matter in the lives of your family. Right. You matter.
We matter. Men, we matter. They need us, you know. We said that man is a provider, protector, a maintainer of his home and his family. You know, our daughters need us to be there to walk them down the aisle, or watch us walk across the stage.
Or help her open that business.
Right. That's right. We matter, you know. So men, step up, get a simple blood test. It can save your life.
Black men at 40.
Black men at 40.
PSA test.
And
know the numbers.
Right.
And monitor the numbers year to year.
That's right. And talk to your doctor, and don't be afraid to go to your doctor. You know, make a doctor's visit annually and go from head to toe. Head to toe, Carol. They need to go from head to toe and ask them to give you that simple blood test that can save your life.
And another delicate thing to say, that if you are suddenly peeing all the time at night.
Right.
And if the stream isn't a stallion any longer.
Right. Those are indicators.
That's
right, you know. And God has given our bodies indicators to let us know when something is going good, something is going bad. If your head continually hurt over and over, it's a sign
It's
you
a sign.
need to go
Something's
to
wrong.
the doctor.
And when I said peeing like a stallion, I mean like a. This is this grown up conversation, okay?
Wrong, that's right.
A strong stream.
That's right.
If it's no longer the strong stream that it
Right,
once was, that is an indication.
Right. Your body will start, but our bodies let us know.
Yes.
You know,
and do not get embarrassed. Get help.
Right. That's right.
Get
Yeah.
information.
That's it. You know, I think, it can really help save the life of a family member.
Absolutely.
You know, and the breadwinner of the family, he this is so important.
Well, Mellve Shahid, I appreciate you, and I'm so glad that you are still cancer-free, and the Empowerment Network is just ever growing.
Thank you, Carol. Thank you for having me on your show.
Absolutely. Mellve Shahid with the Empowerment Network, and they are everywhere. You do just what the brother did in Ireland. Just Google, and it will come up.
Right.
Well, thank you so much for joining us for another episode of Listen St. Louis with Carol Daniel, a life-saving episode for sure. Black men get that PSA test starting at the age of 40. That's 10 years earlier than your white brothers, okay? 40. If your doctor has not brought it up, bring it up to him or to her. And then maybe find another doctor if they are not that informed. Thank you for listening to another episode of Listen St. Louis with Carol Daniel. We will be back next week with more.
Listen St. Louis with Carol Daniel is supported in part by Midwest Bank Center, the Betsy and Thomas Patterson Foundation, and Orvin and Latrice Kimbrough.